Welcome, welcome. My name's Sarah Jones, and I organise these talks. And Janice very kindly has come along to talk to us today. But before we start, how many people here either ride a motorbike or know somebody who does? Oh, not many? Just a few? Apparently, the council now are offering a workshop for people who want to make sure their bike riding is good. For 25 quid, you get an hour with a tutor, and there's only 12 of you, and you go around anywhere you want to actually go, and they tell you whether your driving is good or not, and give you some advice. So if you know anybody who's a bike rider, who thinks they might like that, or they know somebody who knows somebody who's a bike rider, please let me know, and I'll let you have the information, because it seems a real billy bargain. An hour for 25 quid? No, big one. No, it's not. It's from 10 till 4, and you have to bring your own lunch. So there is that. And apparently you have to have enough petrol for 100 miles. So goodness knows where they're going to go, but that's fair enough. But that's not what we're doing today. So obviously today we are going to be talking about a really quite important subject, but we have somebody who's a super expert who's going to share with us. This is being recorded, so if anybody you know is missing it today, there will be a recording put on the website in about a week, because it takes us a little while to edit it. But in the meantime, Janice, if I could ask you to introduce yourself, because you're going to do a much better job than I can, of course.
Good afternoon, everybody. Hopefully you can hear me with this. I'm not used to a microphone, so please bear with me. My name is Janice Madlock, and I am the Deputy Chair of the charity PMR GCA UK. I'm here today to talk to you about two linked medical conditions called Polymylagia Rheumatica, or PMR, and giant cell arteritis, or GCA. Can I just have a show? Have there been people that have actually heard of these conditions? Wow, a lot of people, which is good. One of the aims of my talks is to actually raise awareness of the condition. I was diagnosed myself with PMR in 2013. I was actually only 55 at the time, which is considered quite young for it, but I'd never heard of it. So I muddled through for about 6 months, just struggling. I had some physio, I think, and then when my husband was actually putting on my boots at the age of 55, he said, enough's enough, go to the GP, and my GP quite quickly diagnosed me. I'd never heard of it, and I then spent about 2 years struggling, because I was explaining it to everybody, because people I know had never heard of it. And then I had a meltdown, I think, in 2014, and that's when I discovered this charity, PMR GCA UK, and they were a lifeline for me, and actually it was what helped me to actually manage the condition very, very well. To put it into context, PMR and GCA are very, very common. So there are an average of 40,000 new cases a year in the UK, which is a lot, I think. And GCA, there's 11,000 new cases a year. The average age of it was 72. So when I was diagnosed, luckily my GP did recognise it. I've heard many stories where people have been sent away to say it can't be, you're too young. But I was really fortunate that my GP did recognise it with me already. When I was experiencing my symptoms, I actually realised that I'd turned into my mum, who I'd lost 6 months earlier, and I think the stress of that triggered it for me. It feels that was my trigger. And I realised 100% that my mum had had polymyalgia, or PMR, and had never been diagnosed. And it was on the back of that I like to do this, because I think my mum's quality of life would have been so different if she'd have been diagnosed. So that's one of the reasons for this. They do say there's a genetic link, and lots of people I've spoken to within the charity have had a family member that would have had it. So they do believe there's a genetic link, but there's no concrete research done to corroborate this. They do think there's a possible genetic link, that it can be brought on by stress or a trauma or even a virus. There's been various things. It's a bit like the straw that broke the camel's back, I think, to your autoimmune system. And PMR is one of the most common inflammatory rheumatic diseases in older people. So It does affect men as well. It's 75% female, and they do believe it is linked to the ageing process because, as I say, the average age is 72. But 25% of men do get it. I know some men who've got it, but predominantly the people I come across are actually women. So as from, I think it's 2018, they think there are 200,000 people in the UK with PMR currently, and 50,000 that actually have GCA. So I just wanted to explain what they were. So polymyalgia rheumatica, which is quite a mouthful, and people do generally shorten it to PMR. When I first actually Googled it, when I got it, it actually came out as a record label. So there is a PMR Records. Now hopefully the charity's got a bit further up in Google. It literally means muscle pain all over the place. So, and as we get older, we do get achy, so it's actually recognising whether it is PMR or just us getting a little bit older. So it's an autoimmune inflammatory illness, meaning that the autoimmune system has become a bit overactive and out of control. Doctors may say it's a disease of the muscles, but they don't believe that the muscles themselves are diseased. I do need to stress at this point that I'm actually not a doctor or in the medical profession at all. I'm literally someone who has PMR and suffers the condition and met lots of people that have had the conditions as well. Giant cell arteritis is known as giant cell because abnormal large cells develop in the walls of the inflamed arteries, and it's mainly in the temples here, in those arteries. So the signs and symptoms of the classic signs and symptoms, and I have lots of leaflets here with the signs and symptoms here, so if anyone wants to take a leaflet afterwards, they're more than welcome. So the signs and symptoms are muscle pain, stiffness and tenderness, usually in the neck, the shoulders and the back. And the important thing to know is that it's bilateral, so it's both sides. So it doesn't get confused with a frozen shoulder, for example. I remember having a frozen shoulder once, and it's a very similar symptom, but PMR is definitely both sides, and it can also be the lower back and the pelvis. For me, the most difficult things I had, I couldn't turn over in bed. You might agree with that. I couldn't turn over in bed, getting in and out of the car, getting in and out of a chair, reaching up. I couldn't lift my arms sort of above there, so I couldn't grab something out of the cupboard. I had difficulty drying my hair. I had difficulty reaching things off the floor. They were for me the most difficult, and I think they are quite classic symptoms. You can sometimes get inflammation and swelling on other soft tissues in the body and the joints. And for me and for lots of people, it's an inability to perform simple tasks like grooming, toileting. I remember having a nightmare when I had to get in the car and drive, and I dreaded parking, because if I went into a parking space where there was a car too close, then I couldn't get out the car because I had to swing the door right open. So it's simple things that you was just used to do all the time. It's something that comes on quite quickly, and is often on peak when you wake up in the morning. So my worst time was waking up in the morning, struggling to get out of bed. Once I walked around a little bit, it did ease off, but every time I sat down, it would continue. Loss of appetite, I can't say I had that. And weight loss, I can't say I had that either. But that is a classic symptom that some people have. But as you can imagine, all these symptoms can be so many different things. They do say night sweats, depression, tiredness. So all these things are signs and symptoms of polymyalgia rheumatica, PMR, but they can also be signs of other things as well. So to diagnose it can be quite tricky for doctors. There is not a blood test for PMR. So a doctor will do various blood tests. So they will look at your inflammation markers. You may know your CRP or your ESR, which are also tests for lots of other things. So they will do that, and they're not always raised, which creates a problem. So they will do that. They will also test you for other things as well to rule out other conditions, so therefore rheumatoid arthritis and other things like that. So they will do that. So they will rule that out. And if you're, for me, my inflammation markers were very, very high. So because of that, because of my age, because I'd had the symptoms for 2 weeks, because it was both sides, and because the inflammation markers were high, that was my doctor's sort of theory that that's what I had. So the treatment for PMR are steroids, prednisolone, and I was prescribed 25 milligrams. Anyone knows steroids, that's quite a high dose. 25 milligrams for 5 days, which would confirm the diagnosis for the doctor. So I had them. It was a miracle. So within a few hours, I was bouncing around. It was just a miracle. They worked, and that would confirm the diagnosis to the doctor. If they hadn't have worked, then she'd have had to go back and relook at maybe what was happening with me. They do say that you actually, I mean, considering I was actually diagnosed in 2013, the doctors do say, oh yeah, 2 years and it will be gone. And for some people, that's true, not for me. So as I say, I had 2 years where I didn't know anybody and I was just relentlessly reducing my steroids in order to come off. But I didn't realise that I was actually developing the symptoms again. I was just reducing relentlessly without actually realising what was happening to my body. So 2 years in, I realised I was back to square one. And that's where Mr. Google found the charity and found, for anyone who is interested or knows anyone with the conditions, I found this book. Kate Gilbert is the founder of the charity, and it's a book called Polymylagia, Rheumatica and Giant Cell Arteritis. Not very but it's amazing. So it was like a lifeline for me, and finding the charity, and that's when I think that I started to understand and manage my condition well. I was not told at the beginning when I had polymyalgia that giant cell arteritis was a risk, and also if you're on long-term steroids, there are side effects such as osteoporosis and diabetes, so you have to be very, very aware of that. Thankfully, I haven't got either. So because you're getting it, it doesn't necessarily mean that you will get it. GCA, which as well I don't have, one of the biggest signs of GCA are headaches, and the headaches can be anywhere on the head. But one thing that they do say is they can be on your temples. So where athletes, if they're doing a lot of exercise, this vein, this artery becomes raised, that can happen with GCA without having to do exercise. So that is a classic symptom. Tenderness of the scalp and the scalp area, blood vessels in the temples, as I say, feel prominent, pain in the jaw or the tongue or when you're chewing, and blurred or double vision. This again is a blood test, very similar than PMR. So they will do a blood test and look at your inflammation markers and very similar things. What they will also may do a biopsy, just to make sure that they can confirm the diagnosis by a biopsy, or they have an ultrasound now. Part of the one thing we've done as a charity is we have a rheumatologist that's developed an ultrasound that will actually, it's less invasive, and that can actually diagnose it as well. Prednisolone, steroids, again, are the answer, but a much larger dose, so they can have 40 to 60 milligrams of prednisolone is the starting point, which is a lot, and it reduces complications. And the difficulty with giant cell arteritis, if it is not picked up quickly, people have been known to lose sight in either one or both eyes. So it is really important, and they're the reasons that I like to do this, because I'd never heard of either of them at the time, and people that I know that have lost sight, I know a few people have lost sight in one eye, is because it wasn't picked up. So raising awareness of these two conditions is really vital, and GCA particularly, if left untreated, can be pretty dangerous. So the side effects of PMR and GCA, as I said, the actual not being able to move or the eyesight, but fatigue is a big part of the condition. Fatigue is very different to tiredness. It's very much, I just liken it to bad jet lag. So you may not want to go to sleep, but you just feel really tired. And I remember initially with my husband having occasions when he'd say to me, oh, should we go for a walk or anything? And I'd be like, oh, I just can't. And then he'd try and encourage me, and I'd give him that look, and he knows that I mean it. But then also, I then began to feel very guilty that he thought maybe I was being lazy. So it is really important that if you do use the book or any of the information, that family members read it and understand it as well, because you don't look ill. With steroids, if anything, they make you look really well because they can puff out your face and everything. So I got really fed up with people saying, oh, but you look so well, because you couldn't see it. So the fatigue was very difficult to deal with in terms of how it made you feel. So mood swings, I thought that was my stepchildren, but obviously not. Mood swings can be a part of it. Depression, hot flushes, particularly in the night. So for women, that can actually mimic other things as well, so that's quite difficult. But then you've got the side effects of steroids as well. Whether you have PMR or GCA, there are side effects to steroids. As I said, osteoporosis is one, but they do prescribe calcium tablets to actually hopefully offset that. And you can have a DEXA scan, which will look at your muscle density, your bone density. And there are other things they can give you. Type 2 diabetes is a side effect of steroids as well, and it can be brought on because of the steroids, not because you're eating a lot more, although they do make you hungry, but it can actually produce type 2 diabetes, both of which I haven't had, and so it isn't necessarily important that you will get it, but it's important that you have regular blood tests just to keep on top of those things, so be tested for those as regularly as you can. So as I said, when I found the charity 2 years in, I went to a support group and I met other people with it, and that was absolutely a lifeline for me, because GPs, for as much as they help you, they don't understand how you're feeling, and there's not one size fits all. So as we get older, we may have other conditions that we're dealing with, and we do need to understand all the different things about having PMR and GCA. They are life-changing. Certainly for me it was life-changing. I was actually working at the time, and I eventually took retirement. It is definitely life-changing, but not life-threatening. And steroids seem to be the only drug that works. There's not much research going into an alternative because they do work, and actually they are very cheap. So sadly, there is some research going on, but not a lot. And with the charity, so the charity PMR GCA UK was established about 15 years ago by Kate, who wrote this book, and 5 other people who had the condition, and a rheumatologist who actually got the MBE for services to PMR and GCA in the New Year's Honours List. He is brilliant at actually championing the conditions and looking into research. He was the person who developed the ultrasound, which is now rolled out nationally. So the idea of the charity is to support people with the conditions. So that can be through regional support groups. I run 2 myself in nearby Pinner and Ruislip, which is where I live. There is a Health Unlocked forum, which is online, where people can ask questions and support each other. We have our own helpline where people, volunteers, can actually ring up and get support from people that actually have the conditions or know a lot about the conditions. And we have Facebook and Twitter if people if people want to. We have 8 trustees, of which I'm one. Everyone has a different responsibility, so mine is for raising awareness to the general public. As I said, I'm not a doctor, so I can talk about signs and symptoms, but we have 2 rheumatologists on our board who really champion PMR and GCA, and they help us. One of the rheumatologists is actually working with Kate to produce the 3rd edition of the book. So we want to raise awareness with the public, but we also want to raise awareness with the medical profession as well, because there are times, shall I say, where doctors haven't been very supportive or knowledgeable about the conditions, and sometimes they just want to get you off the steroids, which is, I understand that, which is all very well. However, you can go too quickly, which is what happened to me. They also want to look at things like the employment sector, because I was 55 and working, and so they want to get to the employment sector to make sure that there is support for people if they have these conditions and they're still working. So also we're doing research to promote and encourage research into it. I'm actually on a research project at the moment to try and change the guidelines for PMR and GCA and how it's managed, because when you're diagnosed, everybody is given the same dosage of steroids, and for me that just seems odd, that you might be 6 foot and 20 stone and you're given exactly the same dosage as someone who's 5 foot and 6 stone. That doesn't seem right. So we're trying to get some better management for GPs, and that's not GPs' fault. They obviously have other things to do. So classification for PMR, so I would say that if you're over 50, if you have the symptoms for at least 2 weeks, if it's both the shoulders, so not just one, so both sides, morning stiffness, an elevated ESR and CRP, which are 2 inflammatory blood tests, and I think for doctors the rapid response to steroids will confirm diagnosis. So that's in a nutshell the 2 conditions. I don't know if anyone has any sort of questions. I've got symptoms. I do encourage people, if anyone thinks they might know someone who has it, because what I've described, I mean, I'm sure a lot of you say, oh, I struggle to get out of a chair, struggle to turn over in bed. You know, as we get older, I think these things do happen, but it's actually knowing the difference, because I think I did a talk once in Ruislip, and I think everybody was going to go to their GP with this leaflet, and I think I was going to get slaughtered by the GP surgery. So it is really important to put it into context as to whether you could have it, or you may know somebody that has it, that you could actually take this to the GP and say, just could it be? You know, it might not be, but I know, particularly with my mum, that if her quality of life would have been so much better if she'd have been diagnosed, unfortunately. But I turned into her, which I'm quite proud of in some ways. But yeah, I remember thinking, oh God, I'm my mum. And actually, quick diagnosis, I think, is really key as well, because I took 6 months before I went to the GP, and I really believe that that's why it's taken me so long to come off the steroids. So I came off the steroids last May, so I'm now, they call it remission now, because there have been cases where it has come back, so I've just got everything crossed that it won't. But I think quick diagnosis is important, as is raising awareness, because I was just getting so fed up with people saying, what's that? Or sending me information about fibromyalgia, which is very, very different. So I think, I think it's really important. We do try to have ambassadors, and if we had famous people that had it, I think the awareness would be a lot better. Margaret Thatcher had it. There are people from EastEnders and various people that we do know, but we don't have anyone that would be an ambassador for us, unfortunately. I think a couple of years ago when Lady Gaga came out that she had fibromyalgia, the awareness of fibromyalgia went through the roof. So we're still looking for somebody that could promote it for us. I think there are I think you might all remember PANS people. There are 3 members of PANS people that have it. So, I have heard a lot of people who do a lot of activity in their younger life, but there's no rhyme or reason. And I think there's nothing. I think I was asked the question about prevention. Is there anything that we can do to prevent? For me, it was stress of losing my mum. I couldn't have done anything about that. The only thing I think that would have helped me is if I'd have got diagnosed a lot quicker. But, some people have had it by having COVID, the COVID jab, shingles, shingle jab, virus, flu. A lot of people think that maybe something had triggered it with them. For me, it was certainly stress. Okay, I don't know if anyone has any questions.
I'm sure we do.
I might need to put my glasses on now.
Can you go through the numbers again? The people who are diagnosed each year and how many people in the UK have probably got it?
So 40,000 new cases of PMR a year, and about 11,000 with GCA. They do say, and I might just check with this, that 1 in 20 people who have PMR may go on to have GCA. So it's really, really important that you do know. And I think they said 200,000 people currently in the UK have PMR. It's certainly more common, popular, whatever you want to say, that people PMR than GCA. And we do have members and people that actually have both, which I think is quite tricky for people to manage. People are not often referred to a rheumatologist just for polymyalgia, because I think the rheumatology department would be inundated. People are referred if they have GCA, and PMR tends to be, some doctors I think do just because they're not sure what to do about it, but my GP practice certainly said they would actually manage my PMR at the GP, and that was for me, that was fine.
Now, of course, you've been very clear to say you're not a doctor, which we completely get, and that's absolutely fine, of course. And you are hanging around, aren't you, afterwards, for tea and coffee and so on. So you're happy to take questions one-to-one, aren't you?
Yes, yes.
Right? But in the meantime, does anybody have any non-medical, directly medical questions that they might like to share?
Can GCA be picked up by the opticians on a routine eye test?
Okay, you have been...
No, can it?
My optician, I've talked to my optician about it. I think it really does depend on the knowledge of the optician. I think people have been picked up by opticians before. I think if there was a suspicion, I wouldn't wait for an optician appointment. I would go to I don't know, the Western Eye Hospital or even to A&E. I think I would go. But I think it's a bit like most professions. There are some that are aware of it and some that are not. Be interesting to ask your optician when you're there. Mine does, and I'm not sure. I think he did know. He did know about it. He certainly knew about it after I'd been.
Thank you very much. Another one over there.
Could it be confused with macular degeneration at all?
I don't think it's linked to that. No. That's the difficulty, because I have members who come to my support group. Some have macular degeneration and GCA, and or they are, as far as I'm aware, different.
Any other questions? Oh, at the back here, Guru. We're just making you run, aren't we? That's the thing.
The medical profession seem to give pills for everything. That's their answer. Bearing in mind that this and many other conditions, I believe, are triggered by stress, have you considered any other ways of stress relieving, maybe yoga or meditation of some sort?
In terms of the steroids, there are people that I've spoken to that have decided they didn't want to take them and have gone down that route. But the people that I have spoken to, which is not many, but I have spoken to some people, have often gone back and said, give up, please give me steroids. However, alongside that, we talk about the importance of moving. So I do Pilates. Pilates is, can't get down on the floor very well anyway, but Pilates is really good to stretch everything. So swimming, there are certain movements are encouraged, but I don't think that not taking steroids, I've not met anyone that's managed to get away with that. but the people that I meet are the people that probably struggle.
Yes.
So, you know, I don't meet 40,000 people, so there may be people that I don't know that have done it that way. Certainly helps, Pilates,